going to just check something out here for you. I'm Padraig O'Neill, Medical Director of the Cardiac Electrophysiology Laboratory at Mercy General Hospital in Sacramento, California. I'm going to listen to your heart and lungs, okay? Well, as you can probably detect from my accent, I wasn't born in the United States. I actually went to medical school in Ireland. Cardiac electrophysiology, that is the area that I focus on, dealing with electrical problems of the heart. It really has formed its own subspecialty. So electrophysiologists actually take additional credentials and board certification after being cardiologists in this area as well. We're going to induce atrial fibrillation and see what the shortest RR is, okay? So I want you to ram pace from the CS starting at 290. Our field has been amazing in terms of the rate of change over the last number of years. Things we learned in training are obsolete. Indeed, things we learned 5 years ago are obsolete. So we have to stay on the frontier, on the cutting edge. We're heavily involved in the ongoing clinical research trials, and we've participated in some of the major studies that have been released over the last couple of years. We will do site visits to some of the pioneering institutions, some of the manufacturing facilities where these devices are being created, and in fact most of the staff here consult on these project developments. We're very fortunate in Sacramento to have excellent medical facilities. But I think what, in my mind, makes Mercy stand out is the overall sense of compassion.
How's your head? Can you get another pillow?
I really think it's the ethos and the notion that the patient is number one. A few years ago, we needed additional space, and the hospital made a commitment to build 2 labs specifically to accommodate the electrophysiology component of our activities here. Then we have straight pacing at 400 in the ablator. Around that, we have built a team of dedicated nursing and technical staff to support us.
Are you a little short of breath right now? Yeah. You are? Okay, let me give you a little bit of oxygen here.
I think it is very helpful to me and to the patients to have a staff that is consistently doing the same thing. It's by repetition we get better at what we do, and I think that is a big advantage of having a high-volume institution. Bit of pressure. To do an electrophysiology study, we have to introduce little wires, we call them catheters, directly into the heart on the inside. And we do that by passing them through the veins. Bring in some numbing medication now. That's with 2 and 50 given, correct? Okay, let's give another 1 and 50, please. We use anesthetic to numb up the skin, and we give you some sedation to make you calm and relaxed. As we wear heavy lead gowns when we're doing a lot of these procedures, we tend to keep the rooms relatively cool. Things like warm blankets will help. They're just the little things, extra touches, I think, that just make the whole process go more smoothly for everybody. When we have that sufficiently anesthetized, we will put the little plastic tubes in the veins, and through these we can introduce the catheters into the heart. Now, these are hooked up to our computers, and we can use them to measure the electrical signals within the heart. We can also use these catheters then to pace the heart at different rates, and it is by doing that that we can induce the abnormal heart rhythm that you have. When we've done that, then we can identify where precisely the abnormal element of this circuit is. So what we want to do is take out the bad and leave the good alone. Typically, if we are doing an ablation procedure for a rapid heart rate problem, you will go home the same day. We will watch you for about 4 hours afterwards to make sure you're adequately recovered. If it is a procedure, for instance, like a pacemaker or a defibrillator, we will need to keep you in hospital overnight. In the old days, before these techniques were available, and that's not so old, by the way, we're talking about the 1980s, even the early 1990s, to accomplish some of the things that we can do now with the catheters and accomplish on an outpatient basis, it did in fact require open heart surgery with the attendant recovery of a week in the hospital and maybe a month or 2 to rehabilitation after that. Now with the procedures I'm describing, many people can be back at work the very next day. Well, the principal satisfaction from this job is seeing the results, understanding that a problem has been identified and a problem has been fixed. For many of the conditions we treat, particularly things called supraventricular tachycardia, what we do is definitive. It's one of the few things in cardiology actually where you truly cure it. The other thing that's very gratifying is dealing with people who are at risk of sudden death and in whom it is determined that they should have a defibrillator. The device does what it's supposed to do and saves that person's life. That's a very gratifying response, and it validates we've made the right choices. Another aspect that's very exciting is recognizing how rapidly the whole area is evolving. The fact that we're coming up with new therapies, new ideas, new pieces of equipment, all of which has the common goal of making people feel better and live longer. We'll see you tomorrow, okay?
Yeah.
Good luck, okay?